made Tha-Hla. Thanks everybody for giving us a chance. It's helping the Burmese Delta, and I suppose what's unusual, somewhat unusual, is that I actually come from that kind of community. I come from that region, so I'm kind of quite close to the beneficiaries of the sort of charitable work that we try to do there. The region where we work is in a delta at the bottom of the Irrawaddy of Burma. This is about 250 by 50 miles. 4 years ago, in 2008, there was a huge cyclone that killed just under 200,000 people and displaced about 250,000 people. And so I went out there because there was no aid getting anywhere. So I went out there and did a lot of feeding runs and things like that. And in the course of traveling down the delta, something happened. There were two things that happened that kind of engaged me at the time and changed everything since. The first was that I came across a little boy. His grandmother brought me a little boy whose family had all died in the cyclone, but he had a broken femur in 2 parts. He'd been like that for 4 months since the cyclone, because there was no medicine, no hospitals, no medicine, nothing. There's no traffic, no transport, no roads, nothing at all. He would have to ride a boat for 5 hours, and his family would have to be very rich to be able to be treated. So grandmother said, what am I going to do? He can't walk. That occupied me for ages. And then I came across this village called Ngejidang on the end of one of our food runs. We had some bags of rice, popped in to have a look at the village and just chat to them. And I'm going to show you a picture next, which, if you are sensitive, please just don't look at it. But this boy has to live with how he is. Came across this little boy in the school, and when I asked a bit about him, he was 8 years old. He lived like that for 8 years since his birth. I asked his mother what the doctors had said at birth, and she said, what do you mean doctors? We don't have medicine around here. We don't have anybody. We don't have nurses. They don't even have indigenous housewives. And it really, really gutted me. This is a boy with half his face open. It's like a hair lip, but it's the whole of your face. It's called a Tessier cleft. So what then happened was that I just was really shaken by this thing. It occupied my emotions quite a lot. I did put some something into motion for him, but I thought about the whole of the delta in these hundreds of miles or square miles of land, that there was no medicine, not even a paracetamol in those places. I did come across one sort of jungle doctor type, a self-appointed man who had some animal medicine that he was using, but that was all. So it really challenged us, and I thought, what are we going to do? Then John and I put our heads together with the Laura Case Trust. David Case over there, and his family, is their family trust. And with them, we embarked on a project to train volunteers as community health workers. So that was our first attempt at trying to find a little tiny way of addressing the total lack of any kind of help of that sort in the Delta. So we came up with a project which was to take voluntary workers, volunteers from villages, train them up as much as we could. We designed a training program which lasted a year, and we trained them in all sorts of fundamental health issues. We could never say that we were actually training them to be medics, because that wouldn't be legal. But it was all sorts of training. There's classroom training, where they're taught theory, if you like, and projecting onto a bedsheet, because there's nothing much better than that at the time. There's also practice, so these trainees are shown real applied methods of, in this case, blood pressures, temperatures, cardiovascular. We didn't even have one of those anatomical models, so we have to use real people, our own volunteers. We work in the Delta with a group of local Burmese young people who actually implement these plans of ours. And amongst them there are doctors and nurses and all those sorts of skilled people who put on this program. And it's a very intense program. It includes real-life practice in mobile clinics, and they are actually, they are in full contact with how you would deal with medical issues and so on. They're taught record keeping, which is something that doesn't even exist where there are medical facilities. They're not very sophisticated on that sort. And with these young people, we devise all kinds of weekly tests, monthly tests, and there's a big exam at the end of the year. This is just to illustrate, that we rank them as well. So the outcome is that we've got a whole load of trained people who go back to their villages, who can then start operating out from their villages and help all sorts of people beyond their own village. So in the first project, we probably served about 5,000 people. And these volunteers back in their parishes, having qualified, this girl here is giving her villagers a lesson on hand hygiene. So there's another sort of little satisfied customer. Actually hacked his thumb off. So the plan that we need money from TFN for is to start a second project in a far more remote area even than the first project. For a budget of 15,500, we think we can recruit about 30 volunteers and provide primary health care for another 5,000 villagers and beyond. And the most important thing is that there's a leading medical consultant in Rangoon who is really behind us. Can't do it himself because of official reasons, but he's going to help us put this plan into action. So,
Lovely, Mo.
there. That's the end of the story.